What is the situation with availability of penicillin? Because the Health Secretary, Steve Barclay, we had him on Sky this morning, says people in his department are telling them that there is a decent supply of the drug.
Well, Jane, if there is decent supply of stock, pharmacies are not getting them. Every time they go online to order from their wholesaler, a red line comes up saying it's out of stock. And we are contacting quite a lot of wholesalers around the country. And unfortunately, that's the message we're getting. Now, since November, we've seen a big rise in the number of prescriptions for antibiotics. And so the demand is there, but unfortunately, the supply is patchy. So if Mr. Barclay has the supply, so we would very much like to see this flowing through pharmacies.
Why do you think there is this problem? Is it a localised problem? I mean, you're talking about pharmacy wholesalers. I mean, we know that there anecdotally are some shortages in particular areas, but are you saying that this is across the whole country?
This is across the whole country. So since this morning, I have received a lot of notes and phone calls from pharmacists from north to west to south to east, saying that they are finding it very difficult to order antibiotics. And it's having to call a lot of suppliers, but unfortunately the same message comes through that there is not in stock at the moment. So we're doing everything we can to make sure that we get it for our patients. And I don't want people to panic that there's not going to be anything available. We are really working hard to ensure that we get the stock. And one of the things that we're doing is to liaise with the government to make sure that wherever they say the stock is, they make sure that they flow through to pharmacies.
Because it's not flowing through at the moment. I mean, do you think it could just be a supply problem? Do you think essentially there are, as the Health Secretary says, that there are enough, they're just sitting in a warehouse somewhere?
We don't know, and we've asked the department on a number of occasions to bring stakeholders together from manufacturers to pharmacies and wholesalers to see where the holdup is so that we can then find solutions and plan better. So we know since November that the number of prescriptions for antibiotics have gone up. So by having plans in place, we can deal with it much better in the future. But we haven't heard back from the department, and we are right at the front line having to deal with this.
So have you and your organisation not had any dealings with the Health Secretary at all?
We've discussed with the department people, not the Health Secretary himself. We're very happy to speak with him about it, but we're not getting anywhere in terms of sitting down and talking and getting a plan in place.
Why do you think that there is a shortage? I mean, is it the case that there, as you say, that there have been more prescriptions since November, but presumably that would happen at this time of year anyway, would it not?
Well, compared to previous years, there's a higher demand for antibiotics that we've noticed. Obviously there's been higher cases of Strep A, for example, this winter, and antibiotics prescribed for that. We've also heard that there's going to be more antibiotics being prescribed as part of the guidelines for prescribers. It's a matter of planning better, but the whole supply challenges have been ongoing since the beginning of this year. You may remember the HRT challenges that we had earlier this year. And so that is why it's essential for everyone within the supply chain to come together, facilitated by the department, to identify the issues, Jane, so that we can move forward and we don't find ourselves in this situation over and over again.
Why do you think you are having issues with supplies of different drugs at the moment this year?
Well, it could be a number of factors, but unless we have that conversation with manufacturers, suppliers and pharmacies and the department, all of us together to identify what the problems are, it's very difficult to say exactly where the issues lie. Some manufacturers, for example, tell us that the issues lie with not having the raw ingredients, which tend to come from the Far East countries because of the lockdowns that have had. Is to do with having gone through the pandemic for a long time and the fuel and workforce challenges. So there are a number of factors that they are telling us about this, but it comes down to sitting down and looking at what is the problem and finding solutions and plan better.
I mean, if you don't know what the issue is, it's hard to know how quickly it can be resolved. But do you think there is a quick way of getting these drugs back in circulation?
Well, we are definitely hoping, and as I said, we are really working hard to make sure that we get hold of these, and by liaising with the department and by making sure that there's no stone left unturned for our patients. But at the moment, people are having to travel far from one pharmacy to another pharmacy. I had reports today, for example, that patients have had to go to 12 pharmacies before they actually found antibiotic. Somebody else had to go travel 20 miles to get hold of it. But I want to reassure people that we're doing everything we can to resolve this issue, but we are, we need the department to work with us on that.
How worried are you about this lack of supply, it seems, at the moment?
Well, I am worried about it. My members are worried about it, and pharmacies are. It's a matter of antibiotics are commonly prescribed. I mean, particularly during wintertime, and we don't want to be in a situation where we don't have nothing for our patients. And so the demand is there. We've got to have the supply, and we are on the front line. It's very difficult to turn our patients away, particularly worried parents. But it's out of our control.
OK, Leyla Hannbeck, CEO of the Association of Independent Multiple Pharmacies. Very good to talk to you. Thank you very much.